you so much for joining us today. My name is Batul Sadiq. I had the pleasure of presenting to you a few months ago. And so thank you, Arnaz, for asking me to come back and including me in this discussion. Our featured presenter today is Dr. Sadaf Lodhi, and we are thankful to her for taking out her time to join us. I will go into sharing a little bit more about her background. I did want to first ask if everyone can kindly mute their microphones. We do want to make sure that we're able to benefit from the pearls of wisdom that she has to offer us today. Another thing I wanted to mention before getting started is that this is a safe space. It's a ladies only discussion today. We want to make sure that this is to your benefit. And so definitely feel free during the question and answer session to go ahead and ask the questions you have, as will definitely benefit you, but also others in the group as well. Any specific medical related questions, we will afterwards provide you with resources to connect with Dr. Sadaf, and she can go ahead and connect with you about those specific situations at that time. So without further ado, Dr. Sadaf Lodhi, thank you so much for joining us. And I'm going to go ahead and share a little bit about your background with everyone that's joining us.
Great. Thank you so much for having me on today. I appreciate it.
Absolutely. Dr. Sadaf is a board certified OBGYN and executive coach for women based in New York. She graduated from the University of Michigan with honors, receiving a bachelor's of science in biochemistry. She went on to acquire her doctorate in osteopathic medicine at Michigan State University and completed her residency in gynecology and obstetrics in Michigan. Dr. Sadaf has earned her certification as both a life and executive coach from Rutgers University. She is a sex counselor and educator. As a practicing OBGYN in New York for over 20 years, her mission has always been to empower and educate women. Using her expertise, she helps women with sexual confidence through coaching so that they can find pleasure in their relationships. She believes that all women, regardless of their backgrounds, have the potential to live life to its fullest. I would like to add that Dr. Sadaf leads women's groups through discussions in retreats, by speaking across multiple forums, and by moderating professional conferences. And so we're really, really thankful to her for applying her expertise in that way and joining us again here today. Dr. Sadaf, I wanted to go ahead and of course, welcome you to our Queen Bee's presentation today. And start off by asking you a little bit about your role as an intimacy coach. And so if you can explain to those of us that are unfamiliar with this term, what it means to be an intimacy coach and how you went ahead and got involved in this aspect of your work.
Sure, absolutely. So again, thank you for that introduction and for having me on in your group today. I really appreciate it. So basically, what an intimacy coach does is they are somebody that is similar to what like a sex therapist would do. And that is basically to go over, a person's beliefs and their thoughts about what intimacy is, what sex is, and what that represents for them. And if they're having issues such as those negative beliefs that sometimes they interfere with a relationship, then it's helping that person work through those thoughts and feelings and get to a point in their relationship where they can move forward. Typically, what happens is that a person will go to a gynecologist, and usually a gynecologist is the first person, or, it could be like their primary care provider as well. And usually that's where patients will go. And then when they need help, then the gynecologist, typically doesn't really have time in their office. They're usually busy seeing patients, and usually having worked in several offices myself, usually we only have about 15 minutes. Typically, a question regarding intimacy or sex is, will take longer than that, right? And you can't just answer a question so quickly because oftentimes it doesn't get to the root of the problem. And so what a sex coach does is that they will, actually spend the time, right, to go through the history of a patient and then also try to find out what, the issues are and work toward something that's more positive and where the patient wants to be.
Excellent. And so was it this kind of gap in timing and communication that really led you to move more into this space and providing additional resources maybe to your patients and others in the community as well?
Absolutely, absolutely. So, it's just having been in medical school and also in residency, we just don't get that training at all. And also seeing patients in the office, right? You just don't have that time that you can spend. And I love to ask your people that are watching today, right? Like when you go to your doctor's office, how many of us feel rushed when we're there? And that's typically because the doctor is rushed because they're going from patient to patient to patient. Typically they have over 20 people on their schedule. And so they can only allot like 15 minutes. And if they give you more time, then it means that they're running behind and, it's just a snowball effect for them. So it's very stressful. And so you just don't have time. And so because of that gap, absolutely, I was like, there's a huge need for somebody to step in and help women with these type of issues. And specifically, in our Muslim community, we don't have people that would feel comfortable with this type of, nuanced question and these issues that, are something that we think about and we experience, but we don't have a resource to go to.
Absolutely. And so it puts a lot of pressure on the physician who's rushing through their work and unable to really help their patients in the way they would like to. And so, you kind of touched upon this idea of the Muslim community and certain ideas regarding intimacy and sexual health within the community. So what common challenges or misinformation have you found to be the most prevalent amongst Muslim women when it comes to relations with their partner?
Yeah, absolutely. So, there's a lot, and it's not just, I should say that it's not just Muslim women, right? It's a lot of women. It's just because my niche is Muslim women because I'm Muslim, but I have to, of course, preface it that it spans all types of religions and women and things like that, but and different backgrounds. But specifically for the Muslim women that I've worked with, a lot of times women will feel that like sex is wrong, it's dirty, it's shameful, it's embarrassing. You don't discuss it with other people. It's something very private. And so then they suffer in silence, right? If there's nobody that they can talk to and there's nobody that can help them, then they start to internalize a problem and then they think there's something wrong with them. Where it probably, that perhaps there's something going on anatomically, and definitely that's not something that I want to overlook because, of course, as a gynecologist, we deal with the anatomical aspect and the reproductive aspect of a woman's life. So what I typically like to do, and, I'll get into the questions actually. So you mentioned, what are the thoughts that a lot of women have. So that's typically, basically a sex negativity. There are a few women. So, again, Muslim women are not a monolith, right? So it's not like everyone has sex negativity, and that's not true. There are definitely a lot of women that are sex positive, but the majority of women that I see that come to me that ask for help are people that may have grown up with sex negative perception, maybe in their community, maybe it was something that they always thought, and of course, sometimes women may have experienced like trauma, sexual abuse, things of that nature, which of course will also lead to sex negativity, right? So those are often the thoughts and the perceptions that women have. And also women come to me when they have issues with desire, with decreased libido. And often women think of sex as a chore, right? Like they just don't really enjoy it. They just think it's just one more thing on their to-do list, like kind of like, wash the dishes, do the laundry, go to work, come home, and then have sex. I don't know, but it's just not something that is thought of sometimes for women in a positive light, right? It's just not something
Yeah.
that they often enjoy.
And so what I'm gathering from what you're saying is there's kind of three factors that really contribute to our concept around intimacy and sex. So the anatomical aspect, any experiences one may have had that may have been negative in nature, and then also culturally, the environment in which they were raised and whether there was
Yeah,
shame surrounding being open and discussing these topics, which I imagine can lead to isolation
of
and
course.
kind of feelings that maybe I'm the only one. And
Yeah.
so, as a community, as women, some of whom are parents, who are around children as well, how do we frame discussions around intimacy and intercourse to really create what I know you reference as sex positivity, in an age appropriate manner, of course, but how do we start those conversations from a young age so that when women get to this point, they're approaching it with a more positive perspective?
Of course, of course. And so as I'm just gonna go a little back to the previous question where you had mentioned, you had kind of summarized and said, there was a three-pronged approach, and actually that's the way that we look at it. So from like a sex counselor standpoint, we look at the biopsychosocial model, right? So like if somebody's coming to me for like decreased arousal or decreased libido, any of that sort of question, then we go through the biopsychosocial. And what I mean by that is like the biology aspect of it. So for example, like the anatomic aspect, right? Like, are you having pain with intercourse? Are there issues going on there? The psychological aspect of it, meaning like, what types of thoughts are you having surrounding that issue? And also, perhaps are you having anxiety? Are you having depression, right? Any of those things. And then the social aspect of it goes into like the way that we're brought up, right? Like the community, your parents, your family, your friends, what are the thoughts and perceptions that they may have around sex? So that I just wanted to add to the previous question. Now you
Absolutely.
asked about, how do we approach it with our children? And I think that that's a great question, and a question that I get asked often. So first, what I would say is that I would look into kind of my own perception of what sex is, right? And intimacy. And remember, sex and intimacy are actually two different things. Sex is a part of intimacy, like the physical intimacy, right? But intimacy can be so many things, and we'll get into that a little bit as well. But so when we talk about sex, we have to kind of look at what our own thoughts and feelings are regarding that topic. If we ourselves are sex negative, then that's the perception and the attitude that we are going to then transmit to our children, right? So if we want to change that and we want to make it more sex positive for our children, and sex positivity is really about, again, our thoughts of what sex is, what it means, and how we relate to it. So if I'm going to change that, then I have to really assess what my thoughts are when it comes to this. And then that's where it all starts. So then I have to, if I have a very negative perception, then I have to see whether or not it's serving me. And if it's not serving me, then how can I change that, right? So then that's the first step to doing, talking to your children about it. The second thing is making it age appropriate, right? So we're not going to be talking about the intricacies of a relationship or sex with like a 5-year-old, right? That's not appropriate.
Sure.
What I would do though is I would teach the appropriate names of body parts to a child, right? So I wouldn't call, and I think I had talked about this once before. I'm not sure if you were there in the retreat when we talked about, but like I wouldn't call like the vulva, which is the female external genitalia, like a cookie or something like that, or some other name that you make up for
Sure.
it. Because, if that child ever gets abused or is touched inappropriately, then they won't have the words to tell you what's going on, right? They would use the word that you taught them, which was, I don't know, like a cookie or something like that. And somebody says, like, oh, a child says, somebody touched my cookie, you wouldn't really know what that was in reference to, right? And so I would always start with using the appropriate words, the nomenclature for the appropriate body parts, right? There's no shame in that. That's what Allah has created. That's what we should be teaching our children. And then as they get older, I would teach them the awe and the beauty of puberty and the changes that we go through in life. I would, try, if you feel uncomfortable with it, then try to get comfortable with it. Try to, say those words to yourself when you're by yourself so that you feel comfortable, maybe explain those changes, or read about those changes yourself so that you feel comfortable addressing that and addressing the appropriate words. And so that you can, when you talk to your children, they don't see you like squirming. They don't see you like really feeling uncomfortable, because then they'll feel uncomfortable, right? And you always want to make the relationship between you and your children an open, safe space so that they feel that they can come to you and that they always come to you first before they go somewhere else to get their information. The studies have shown that most children see porn by the age of 11. They've already experienced porn. So if we want to be our children's first teachers, which we are because they're with us, then it's really important that we have that open communication with them and we allow them to ask questions.
So it seems that self-reflection is actually helpful in so many ways, because it helps with the communication and teaching to our children, aside from the immediate benefit of really educating ourselves and staying on top of our thoughts around intimacy and sex, which you very eloquently explained are two different things. It can help in terms of safety, so our children understand what is appropriate, what is healthy, what is not healthy in a relationship, and those are extremely important. And it definitely starts with us. And so I can see how the coaching, there's much benefit to it, because as we learn, we can teach that and foster those discussions around intimacy and sex, just because, when it comes to children, like you said, we do want to be their first teachers. We don't want them going to external sources. We don't want them to find things on the internet that, we wouldn't agree with that are not good for them. So that's a great point that you raise. Kind of coming back to women as an individual, what would you say are the top 3 things that we should really focus on as we embark upon this journey of learning more about our health and intimacy and libido and some of the other things that you had touched upon?
Yeah, absolutely. So again, I would go back to that biopsychosocial model, right? So I would suggest and request that women stay on top of their own physical health. So, in terms of your GYN visits, right, gynecology, I would make sure that you go and get your yearly physicals, that you go and get your pap smears, that you get your mammogram, that you do all of those very important things that you need to do to maintain your physical health. In terms of your mental health, right? What are you doing to help with that, right? Are you suffering through anxiety? Are you suffering through depression? Do you need to see a therapist? If you need to see a therapist, you should know that there's no stigma. There is tons of stigma, but I mean that there's no shame in going to see somebody for mental health. And that's very important. I tell people that I have a therapist. Everyone has a therapist. They should have a therapist. I think that, there's only so much that you can rely on with, going to your friends or going to your family and things like that. After a while, you don't want it to become a burden for them, right? Sure. And so we should normalize the conversation around mental health. And we should, if people need it, they need it, and they should go seek help, right? Because that's only going to make them a better person. I think also looking at our thoughts and feelings surrounding difficult conversations, difficult subjects, so that we can be resources for our community, our children, and for people that need us. And, the other thing I would say is the last thing is prioritizing communication with your kids, but really your intimate partner, right? Your partner that you
Yes.
have that you may be experiencing some type of difficulty with, and making sure that you have that open communication. And it's really tough, right? Like you may be
Yeah.
married to somebody for like, I don't know, like 20 years. And all of a sudden, now you're like, oh, by the way, haven't been happy with the sex we've been having for the last 20 years.
Right. It's a hard discussion. Yeah.
Yeah, absolutely. And so that's why it's important to first go and feel comfortable having that conversation, right? And then actually having it and prioritizing it. And that's one of the biggest things when they've done studies on women or on people that have stayed married for long periods of time. What they found is that those people that prioritize their relationships are the ones that end up staying together. Right. So you want to be a couple that stays together, that has that open communication so that you can discuss your thoughts and your feelings and make it a priority, right? Perhaps set aside like 10 minutes at a time where you are both available, and then you slowly increase that time. So just so that, you increase that discussion and you have that open communication.
Sure. And I mean, often, that idea of communication with partner is essential, right? And so partly in order to be able to communicate effectively, we need to kind of remove that shame or that hesitation, really self-reflection and understanding what our needs are so that we know what we're communicating. Have you found in your experience that men or other partners are also equally involved in that communication process? In your experience?
Yeah, it's tough to know. I mean, I mostly deal with women as a
Okay.
gynecologist and, as an intimacy coach focusing on Muslim women. I don't really have the access to their partners, and to find out whether or not they're actively involved in trying to also help with that communication aspect. What I hear is from the women that, come back and tell me what's going on in their relationship. So I think it's like 50-50, right? And I think that if a person is not willing to talk, then you probably have more issues in that relationship than just intimacy, right?
Sure.
I think that, and actually there was a study that I just read that there's a scale, there's a tool that we use for female sexual satisfaction. And they stated that in that screening tool, that the greater that women were satisfied, the happier they were in that relationship. And that was actually, sexual satisfaction was actually used as a barometer for the relationship. So that is.
Not able to hear you right now. Are you all able to hear me? Are you able
I
to
can hear you. Sorry, Dr. Lodhi, if you could just unmute yourself. I think it was accidentally muted while someone else was talking.
Okay, can you hear me now?
Perfect, yes.
Sorry about that.
Okay, no problem. So what, can we go back? Let's go back to that question. What were you saying?
Yeah, so we were actually talking about the screening of sexual satisfaction in women and how that relates to their relationship.
Sure. Yeah. So what I was saying is that there's a screening tool for sexual satisfaction in women. And what they noted in that study was that the greater that women were satisfied, that was actually a barometer of their relationship. So more likely they would be happy, or that they were, satisfied in their relationship if they were sexually satisfied. So that was a really important study that was done.
Yeah, no, and there's so many studies out there that I know I personally am unaware of. And so I'm sure others as well maybe don't have access to it or who don't know about it. So certain screening tools, are there things that, being at home, I can kind of look to as a resource to kind of start my journey in learning and understanding and fostering that.
Absolutely. So there's a few authors that I absolutely love, and there's so many out there. And I think that first and foremost, the easiest thing I think for anyone to do is to perhaps even just go to your library, right? I'm actually sitting in a library right now, and I love this library. I was like,
My
oh my
favorite place. Yeah.
God. Right. So there's, it's so nice to be among books, but really, I would just go to the library and maybe look up a few authors that I'm going to tell you about, and you can decide if you want to read them, and maybe you have your own, right? But so I would say that really an easy resource is to look up some books. So there's an author, her name is Emily Nagoski, who I like. She wrote the book Come As You Are. There's also another author called, her name is Esther Perel, and she wrote a book called Mating in Captivity. There is a Muslim author, actually. His name is Habiba Kande. I've had him on my podcast a few times. Actually, I think we've done like four podcasts together. He's amazing. He is. So I should preface that, I think he's amazing. Maybe some people may not think he's amazing, but his Instagram is a little bit different. So I don't always look at all the things he posts, but the point is that he wrote a book. It's called Women of Desire. And I like it because what happens, Batul, is that a lot of times some women, right, may think that if they learn about this, then it's shameful and dirty and that we're not supposed to. And I would counter and say that actually in Islam, Islam is a very sex positive religion. Now, when I learned that, my mind was blown. I had no idea, right? Growing up, not really having access to any type of information like this, I didn't even know that Islam was a very sex positive religion. So when I found that out, and when I was able to research and look and find out what the Quran says, what the Hadith say, and that knowing that sexual pleasure is actually a right that Muslim women have was very important for me to know and understand. And knowing that, I don't know if somebody can mute themselves, but so knowing that Islam is a very sex positive religion for me was very empowering, and knowing that I had the backing of my religion, because I'm actually a very religious person and religion is very important to me, and so it almost gave me permission, right? So knowing that about Islam gave me permission to learn and really write about it and talk about it. And knowing that, I also gave myself permission. And that's why I named this talk, actually, Give Yourself Permission, because knowing that, we are able to, and we are encouraged, and I can go on forever about this, but in Islam, right? Like, so what is the first thing that the angel Gabriel said to the Prophet, peace be upon him, right? Sallallahu alaihi wasallam, was Iqra, read. So it behooves us to read and to learn and to educate ourselves. And so that's why when we learn that Islam is very sex positive, then we should also learn what Islam says, and that we have a right for sexual satisfaction.
I just wanted to reiterate if everyone can please mute their mic. Thank you.
Okay. I don't know where I was. Let's see.
Yeah.
Yeah, go ahead.
No, go ahead.
I was just saying that, so just knowing that Islam is a very sex positive religion gives, the person permission to learn about this topic, which is considered very taboo. And so then you can read about it. And so the author, Habiba Kande, he basically kind of just goes through what Islam says about sexuality and actually eritology, which I never even had heard of before. And just basically, it allows Muslim women to go ahead and explore and learn and read and educate themselves.
And it's very liberating to know that our faith actually supports us as women, and like you said, in giving us permission to explore and learn these things. And so it's so huge for us, like you said, to educate ourselves. Like, it's okay to learn about these things and understand, so that we are informed for every step of the way. And as we grow older, relationships change, things like that. We have a better understanding of ourselves and others. to promote that education in health. So great point. And Arnaz, maybe as a follow-up, we can summarize some of the books and authors that Dr. Sadaf is mentioning, and then we'll share that with the group again, if that's
Yes,
something
absolutely.
you would like to look into. I did kind of want to inform everyone that Dr. Sadaf has, many resources across social media and, group coaching, one-on-one coaching, and we'll get into all of that in a little bit as well. But I did kind of want to start opening up the group for some questions, if that's okay, Dr. Sadaf, if we start with the
Absolutely.
questions and the Q&A portion. Arnaz, if we're able to maybe stop recording, and so this way, we want all of you again to know this is a safe space. We're open to questions. Dr. Sadaf is a great resource, and so this is a great time to go ahead and ask those questions. If you'd like to either put it in